The occipital bone, or os occipitale, is located posterior inferior in the neurocranium. It contains foramen magnum, through which the neurocranium communicates with the spinal canal. It has three parts, and they are located around foramen magnum, so their naming is easy to understand based on their relationship with foramen magnum. So the anterior wall of foramen magnum is created by pars basilaris ossis occipitalis. The lateral walls are created by the symmetrical pars lateralis ossis occipitalis, and the posterior part or margin of foramen magnum is created by the largest squama occipitalis. The margins of the occipital bone are in contact with several bones around them. So anteriorly we have the sphenoid margin. Practically it sutures to the body of the sphenoid bone, creating the synchondrosis spheno-occipitalis, which in turn will ossify and create the suture between the two bones. To the side, it comes in contact with the pars petrosa ossis temporalis, and then this margin continues to contact the temporal bone, but this time along the pars mastoidea, so that's why we call this margin margo mastoideus. And then a long contact occurs with the parietal bones, so this margin is called margo parietalis. The two parietal margins with the two parietal bones create the sutura lambdoidea here. On the isolated specimen of the occipital bone, we can see the external and internal features of the bone. For reference, I'm just going to place the skull next to it so that we can see its relative position within the skull, like so. So the external surface will have, obviously, presenting the three parts. Compared to foramen magnum, we have pars basilaris, pars lateralis, and squama occipitalis. The pars basilaris has only one feature, the tuberculum pharyngeum, which is obviously the attachment for the rapid pharynges. Then on the lateral parts, we have condylus occipitalis on both sides that serves as a attachment area or joint surface for the atlanto-occipital joint. This is crossed transversally by canalis nervi hypoglossi, and behind it we will have a so-called fossa condylaris, a depression where canalis condylaris starts. This canalis condylaris usually crosses the base of the condyle in an antero-posterior direction. On the squama occipitalis, we have the central element we call protuberantia occipitalis externa, from which a crest, crista occipitalis externa, is headed towards foramen magnum. Then we have a series of symmetrical lines. The one that is at the same level as protuberantia is called linea nuchalis superior. The one below it is linea nuchalis inferior, and the one above is linea nuchalis suprema. Now the internal surface, again, the skull for reference here, so that we can see the relative position of the specimen in the skull, like so. Again, we will have the pars basilaris right here with the two lateral parts and the squama occipitalis. So the pars basilaris has this area, flat area, which we call clivus, and the two sides of the pars basilaris have a symmetrical groove, which we call sulcus sinus petrosi inferioris. Now, on the lateral parts, the central element is this tuberculum jugulare, the jugular tuberculum, which is called like so because of the incisura jugularis, which is right here at the margin of the bone, which incisura jugularis, together with the same incisura jugularis from the pars petrosa of the temporal bone, creates foramen jugulare. In the middle of incisura jugularis, there is this proeminent little bony spur, which we call tuberculum intrajugulare, or processus intrajugularis, better yet, which separates into two the foramen jugulare, and in the posterior part of the jugular notch we have this tuberculum jugulare. Now on the side of of the pars lateralis, we have this groove which is practically holding the end of the sinus system of the brain, of the skull, which is called the sulcus sinus sigmoidei. Now, posteriorly, in squama occipitalis, we have this so-called eminentia cruciformis, which is created by several components. The middle part, or the central element, is protuberantia occipitalis interna, which is continued, obviously, similar to the outer part or surface, in crista occipitalis externa. The upper part of the eminentia cruciformis, this area is called sulcus sinus sagittalis superioris, and we have the two symmetrical arms to the sides, which we call sulcus sinus transversi, both of them. Now, this eminentia cruciformis creates four depressions, symmetrical ones, obviously. Inferiorly, we have the fossa cerebellaris, which both of them hold the cerebellar hemispheres each, and the superior ones are called fossa cerebralis, and they are practically in contact with the occipital poles of the brain.